tests that people take in their various countries of origin before coming or arriving into Ghana, are they authentic? The results that they are presenting to us, are they authentic? And then we're asking the safety protocols instituted at the various airports. Is there something wrong with those protocols? Are there problems with it? That is why we are beginning to see this kind of situation at the airport. Measures to ensure the safety of immigration and other officials working at the Kotoka International Airport. Are there enough measures to ensure the safety of these workers? These are some of the issues that people are raising and some recommendations. The minority in Parliament today, for instance, issued a statement and recommending some steps to be taken by government to deal with this situation before it escalates. Because, of course, we have India just right there, and we're seeing what is going on in India. There are other countries who are also experiencing the third wave of COVID-19. Do we want to wait to get to that stage? So the NDC's, the minority in Parliament has recommended that a determination be taken on how so many travelers are able to pass through the first screen procedure of a PCR test at their country of origin and land in Ghana having a COVID infection. So this is something that they're recommending that government must look into. Government should also consider travel restrictions on countries currently experiencing high COVID-19 infection rates. This comes with a lot of implications. We'll be gauging the mood of the experts to tell us whether it's actually the right step to take or we should wait. So as at a total number of people that were tested as at April 21 were 233,054. 233,054. Those are the people tested as at 21st April. Now, out of the 233,054, 1,497 positive cases were gotten out of the 233,054. Should we be worried about this situation? That is the question we're asking tonight. My guests tonight are the experts who work in the various fields, the virologists, the public health experts, the doctors. All of them will be telling us. Dr. Justice Yankson is the General Secretary of the Ghana Medical Association. He's joining this conversation. Dr. Michael Owusu is a virologist at the KCCR, and he's also a lecturer at the Department of the Medical Diagnostics at the K.I.A. Dr. Kwabena Mensah Akando is the minority spokesperson on health, and Dr. John Amoesi is a public health expert and lecturer at the School of Public Health at the K.I.A. I'll take a break. When I return from that break, and of course, unfortunately, Dr. Frank Asiedu-Bekoe was supposed to join the conversation. He's the Director of Public Health at the Ghana Health Service, and he's unable to join, but we have his boss's word on this. We'll be sharing with you, and we'll be telling you about the decision that is being taken by government to deal with this situation. Stay with me, I'm coming right back. Welcome back to PM Express. We're discussing the rising numbers of COVID-19 cases at the airports as the Frontiers Group wrote to the Ghana Airport Company, alerting it of the dangers ahead. And this is the letter. And let me start with you, Dr. John Amoesi, and I'll read excerpts of the letter that was written to the Ghana Airport Company. It says, today, 24th of April 2021, that was yesterday, we recorded 75 positive cases. This exceeds the previous highest rate of 45 positive cases on the 21st of April. We once again appeal to all stakeholders to implement stringent measures on the quality of PCR results acceptable for entry into the Republic of Ghana. It has become imperative to implement new guidelines to curtail the influx of positive cases into the country. Please, and it talks about the details that it has forwarded to the Ghana Airport Company for its perusal. Dr. Amoesi, how worrying is this warning coming from the Frontiers Group? I mean, looking at what we're seeing in India right now.
No, thanks, Ash, and good evening to you and to my colleagues, Michael and Justice, and to everyone listening all over the country and, in fact, all over the world. I think it's really great that we can have this conversation tonight. I think it's been long overdue, largely because we've been seeing the lower numbers, and so I guess everyone is feeling a bit more comfortable. So I'm glad this is back on the table. I think we need to, take a step back and look at this letter, whether it was, meant to be public or leaked or whatever that we have, and good enough that we can read this letter. There's two things. One is it signals that we've got a system that is running. So it would be more alarming if these individuals were not detected at all. And this has always been the paradox of public health. You only see a face of public health when things are not working. But when things are working well, you will not see public health at work. So here's a case where this company has been able to point out that we detected X number of people coming in, which is a significant increase over a certain period of time. If the net was not working well enough, we would not be able to pick up these numbers. So there is actually a very bright side to this, which is it shows we have a system which will pick up if there is a blip, we will catch it. Now, the second thing is this, which I find rather strange and unfortunate, was not provided, which is to really understand what this is in terms of relativity, proportions. We talked about 45 positives being the highest point on April 21st. And then this next time we had the 75, and that's quite a huge jump if you look at it in terms of ordinary numbers. But I would love to see what proportion of people tested on April 21st versus the proportion of people tested on this new date I can't just remember off the top of my head. What does that mean in terms of the proportion? What you provided us with and what we know is the proportion of positives over the period of time, which is the 233,054 that were tested and the 1,497 positives. That takes us to 6.5%. But if you really want to determine whether there is a significant jump or whether there's a real cause for alarm in terms of the numbers of positives that we're seeing, then you need to express this as a proportion at the very least. And then you can compare the two. The other thing about this is, and that's a question we should be asking, unfortunately, I'm not hearing a lot of that, is what is being done with these positive people? Because fine, we cannot control how people get their COVID out there and come into Ghana. So the question is, if we are having such a robust system which is able to catch them when they come in, what are we doing with them? Are we letting them go home and self-isolate? That would be totally wrong. Are we isolating them and keeping them on the watch and testing them, till we know they're clean and releasing them to go? If we're doing the latter, then that's great. And I would say that, well, then there's no real cause for alarm. But if we're not doing that and allowing people to go home and self-isolate, then that could be a problem. So you need to look at this from different angles. Of course, there is the issue about, variants and the possibility of, variants just parachuting into the country versus variants that emerge from within. When they parachute in, it's a bit more complicated, and they'll parachute in from the airports. And this is why, if you look at the map provided by the Ghana Health Service and all the maps available on Ghana, you'll see that Accra is red. This is not because, I believe, not because of the local transmission, which of course we know will be higher in Accra because of how densely populated it is, but also because we're getting the cases coming in. And so we detect them at the airport and they go into the Accra database as Accra cases. So it is really important to really pull this apart. And maybe I'm jumping the gun, but if anything should be done right now, it would be to ramp up the quality of our testing, just like has been called for, so that we can, it's like you have a net or a sieve and you're making the hole smaller so that you can really strain and make sure that you catch anything that is trying to come through. Second thing is get your isolation centers up and running, make sure that people are being constantly surveilled when they are isolated. And then you may want to take that additional step of maybe banning people coming from places that have very high numbers and also have variants that might be of concern. But that's slightly more complicated. but must be on the table. I'm not saying it should be done just now, but it's not an option that should be off the table.
Dr. Youngson, let me bring you in here because you said that what we are experiencing or the situation we're seeing at the airport hasn't reflected at the hospitals yet. What does this mean? What are the implications?
Hello, Aisha.
Yes, Dr. Youngson.
Okay, so let me just continue from where Dr. Amwesi just ended, and then I'll come back to your question. The truth is that issues around where these travelers are being kept at this moment is very important. We need not make the mistake of letting anybody slip through the nets such that they will end up in our communities. That was the mistake we did along the line in December, January, when some travelers were allowed to go home, and then that ended up contributing to the spread. At this point, we should be very, very vigilant, and we should be very strict. If we take a decision, for example, that travelers from certain parts of the world, because of their high-risk nature, are going to be quarantined, it could be 10 days, it could be 7 days, it could be 15 days, whatever days we decide. But if you look at the way the disease evolves, anything from 7-10 days to a maximum of 14 days, we are likely to catch all those who are incubating. You know, some of these strains that are out there that potentially can be imported could be deadly. For example, the Indian strain that we are dealing with now, if we don't take care and we get that strain here, if you look at the mortality and the morbidity associated with it, then clearly this is a very virulent one. And what that means is that our experts here who can do the gene sequencing as well, the genome sequencing, should be taxed, should be resourced to be able to do the sequencing as these travelers are being picked at the airport. It shouldn't be that they just tested positive, they go into isolation centers or whatever, and they are left to go. No. So that we can also see what is happening and benchmark what we are also probably finding in our communities in terms of what we are testing out there. That way we can be very sure that, look, nothing is actually slipping through the net to go into the general population, and then we're going to have problems. There's always been that sequence that whenever we are going to get a wave, it starts with imported cases. Okay. That was the first wave. The second wave, we had our own cases here, but you could see that a huge number of imported cases also accounted for what we saw. And the spread leading to the presence of the UK variants and the South African variants and all that clearly were from people who were traveling. We should be bold at times and say that, look, this is how we're going to go. If, for example, like Dr. Amwesi was trying to say that, yes, there are some decisions that you need to take a lot of things into consideration. And I very much agree with him. But beyond the economic, the political, and all the bits you can, sometimes you also need to look at your peculiar situation and take the strict measures that will help you. For example, if we decide that because of what we are seeing, all travelers are going to be quarantined for, let's say, 7 days to, say, a week or 10 days before they are let home, where we are going to test them and be sure that there is nobody who is incubating and potentially will slip through and go into the community. Then we take that strict policy measure, we announce to the whole world that quarantine period will be at your own cost. For example, we need to start doing some of these things because we cannot afford to lose our guard a third time. And looking at the K.I.A vaccine situation that we have at this moment, we are actually more or less in a limbo now. And we are not too sure how quickly we are going to ramp up the numbers in terms of the general population that will be vaccinated, looking at what is happening out there in the world. So we need to be very careful. But back to your question proper, in the communities or in the hospital, yes, we may not have had a surge. But the truth is that anytime you are going to get a rise, you always will play along the lower limits. So this also tells us that at the clinical end, we need to start being extra vigilant, such that we'll be able to test a lot more people, and then we'll also know that, look, whatever is happening out there, we are not so remotely placed. Whatever happens in the other parts of the world, invariably, we get a certain mirror reflection here. A first wave, we also had our first wave. A second, we had our second. And now there is a third. God forbid, but we need to act and act properly so that we don't fall into that trap.
Dr. Michael also, there are those who feel that even the cases that we say is declining in our country, there seems to be some relaxation in our testing regime, and that could be the reason why we say the numbers are declining. But that notwithstanding, in terms of immediacy, what kind of action would government have to take so that, number one, we don't import large number of cases into the country, especially new and dangerous variants? Dr. Uso.
Yeah, good evening to my colleague John and Just. Yes, hello, can you hear me?
Very well.
Hello?
Loud and clear, Dr. Michael.
Yeah, Aisha, can you, good evening. Good evening to John and the Justice as well. I think they've made some very good points about how best we can handle this as a country. And I mean, the question is not just about having imported cases, but for us who have been reading about the virus, it looks as if the nature of the virus is what seems to contribute to the different waves that we have. I mean, most of the first wave that occurred from last year, March to somewhere December, was mostly by the main reference sequence, the D614G, that contributed to high level of transmissibility and high level of mortality. And it looks as if you look at the US and American, that's what contributed to the second wave, even in Ghana. So as you mentioned, the fear that not just people bringing in ordinary cases, but if you have countries that seem to have variants under investigation, such as what we are discussing, I mean, the B1617, which we don't seem to know much about, but it looks as if it's highly virulent and is not much known to the world, and many of us may be still susceptible to. Then, of course, you want to put in some high level of measure to ensure that you don't, you reduce the risk of possibly not allow this to enter into your country and then cause much damage. So, on the point of it, for me, I think it should be one of the key reasons why perhaps government should possibly consider how to enhance its measures. I know at the airport now, if you are positive, you will be isolated and maybe managed. But then if you are negative, I don't know what happens to you. It's likely you may go through the system. But we are here discussing about incubation. So if you have 100 people coming and maybe 20 of them are incubating the virus, this may slip into the country. And if they carry any other variants like what we are discussing, it's only a matter of time, and this will build up in the community. This will infect people, and this may contribute to a possible third wave. So if you ask me what we should do, this is something that will require some high level of discussion. But I think that, like Justice said, if you could perhaps introduce a quarantine of a sort, where people from high-risk countries who test negative will still have to be monitored for about 5 to 10 days to see whether they will develop the symptoms. And then if they develop that, you test them. Or even before you discharge them, you also tell them if you feel that they are mostly may carry this. I think if you do that, you have a chance of possibly limiting this virus from getting to the community. So I think at this point, we may have to toe the line of what other countries are doing. I know the UK is planning of instituting these quarantine measures. I know places like Oman are trying to ban flights from India, just to give you some breathing space to plan well. Because if you don't plan how to deal with this and it enters the country and the hospital begin to experience the effect of it, it will be too late. You know, normally, once the hospital begin to feel the effect of it, it means that it's gotten out of hand. Your best bet is to now put in measures to resource the health sector, deal with the surges in cases. But if you don't want to get there, then of course you have to put in some measures very early so that you prevent that from happening.
There are already questions about the antigen test that is taken at the airport when the passengers arrive, and the PCR test that is taken from the country of origin of the passengers. I mean, what really is the case? Dr. Michael Owusu, I'm asking whether...
Well, I think this case has gone forth and back. The point is that... Yes, so Aisha, ideally, if you test negative PCR in your country of origin, and you also get to, window period, it is possible you may test negative, but at the point that you did a test, you might be incubating the virus. But you may get into the country and maybe you were negative in your home country, you got here, the virus has expressed itself in you. And at that point, the system will detect that indeed you have it. There are also questions about PCR compatibilities and limits of detection. If you have to look at all PCR platforms, they are all not the same. The limits at which one PCR will detect a virus is different from what another PCR will do. So for instance, if India, for instance, have a PCR machine that detects a minimum of about 200 copies per patient, and then in Ghana, we have a limit of 5 copies per patient, we have a higher level of sensitivity. We can detect what the Indians will see as negative. Because as we speak now, we don't have a uniform, harmonized SOP on the common platform that all countries will have to use. Every country using their own PCR technique, every country using their own reagents, and every country have their own protocols. So until you are able to harmonize this and standardize it, it will be difficult for you to say that one PCR is positive and therefore you are sure that another will be negative. It is more of a level of risk you put in to ensure you minimize as much as possible, but that is not a zero risk. It is possible that with all these measures in place, there will still be some level of opportunity that some people may use this in a way to get into the country. But there's also a question about fake results. For instance, some may manufacture fake PCR results in their country of origin. And if they also get here and we test, we may also find this as positive. Currently, the African Union has introduced what we call the PanaBio system, which will allow all PCR results to be digitized. So once you do the test, you have a QR code that can be scanned at the airports, and then you'll be able to see. And this QR code is linked to the testing centers. So this may be one of the measures that can limit it. But even this, we will not succeed in removing all the others. So there are so many things that have to do with it. That is why when, as a country, you feel that other countries close by or maybe are likely to pose high level of risk to you, in addition to all the measures, you have to still try to enhance or try to do something more other than what you have, so that as much as you can, you limit importation of this. If you don't do that and you only count on your systems, things may slip through. Before that, somewhere in last year, November, December, we had the systems in place. But we had the B117 slip through the country and contributed to large second waves, as we saw in January, February, March. So what is going to happen is, if we don't do something about this and we still don't manage it well, it is possible these new variants may contribute to a possible third wave. And third waves could be more severe, could have high level of mortality and morbidity, and could be something that we may struggle to deal with. So as we discuss this, I think it's important that we have something to do that's good for us to do it now, and not to wait for the health sector to feel the effect of it, which may be too late for us to deal with.
Kwamina Mensah Akando is a spokesperson for health for the minority. Now, Sakando, you issued a statement and you gave a number of recommendations as to how the country should deal with this. But fundamentally, you cite either poor testing or fake results, and which Dr. Michael Owusu has accepted or admitted that it's something that can happen. Have you independently verified this, and what are your findings as at our airports? What is actually happening in our airports right now?
Well, let me first and foremost say good evening to my colleagues on the various lines, and say good evening to your viewers. And to proceed, we have not per se done any independent work, but you see, if you continue to record such a high number of cases from a country or from a country of origin where people have already done PCR tests. The question is, why would you do a PCR test in the country of origin and then on arrival you test positive? So, I mean, this is common sense. And it clearly tells that, looking at the numbers, it clearly tells that there is a possibility of fake results and whether or not they contracted the virus in transit. So these are the possible issues we should begin to analyze that we cannot sweep under the carpet. And one of the doctors raised an issue of having a robust measure at the airport, and that is why we are able to detect these positive cases. It could be so, if and only if we don't have these cases, positive cases already in the country. Some of them already in the country. If you recall, during March last year, before we reported the 2 positive cases, we already had cases already in the system. Okay, and the most complex of it all is the issue of the incubation. You know, there is a higher probability that if you record as much as 75 positive cases within a day, then there's a higher probability that there is a higher people who are also incubating as well. And as I speak to you now, those who test negative on arrival are not quarantined for some number of days before they are left to mingle with the other people in the country. They are left to go to their various service at home. Okay? And those who test positive are the ones who probably are quarantined. And of course, this issue of go home and quarantine must also be a no-no situation. And you see, we get there when we sit until our health facilities are getting overwhelmed. We have no option to ask people to go home and quarantine. You know, so since we are taking this side, I think that it's about time to put strict measures in place. For example, we need to enforce some kind of restrictions on the high-risk countries. Okay, first and foremost, we can draw their attention to what we are recording in our country on arrival of their passengers. Because they do the PCR test in the where they are coming from. And yet when they get here, they test negative, they test positive. And so we need to draw their attention, and within some number of hours or days, if they don't check it and we continue to record higher number of positive cases, then we go ahead to institute some kind of measures to prevent or avoid this third wave in this country. So for me, irrespective of economic implications, I will always put the health of the people first.
Okay.
Yes, we must protect our people, especially so when the virus is imported. My sister, let us be very, very careful. We are lucky that both the first and the second wave in Ghana, we have the epicenters to be the cities where we have seemingly strong health centers or hospitals. If it had happened in our rural communities, only God knows what would have happened, because our health systems in our rural communities are nothing to write home about. And so we don't need to joke about this at all. We need to take bold steps right away. Right away.
Let me bring in Dr. Amoesi here. Dr. Amoesi, there's some who say, really, 75 cases at the airport, is it such a big deal? But of course, let me ask you how dangerous a third wave would be to Ghana. Dr. Michael Owusu has already indicated some of the things we may face if it happens, but how dangerous is this?
No, I think it's a really important thing we need to square up to and discuss dispassionately. For the past 2 weeks, I have been personally raising the alarm of the possibility of a third wave. I think Justice hit the nail right on the head when he said that whatever is happening elsewhere is always mirrored here. It will be ostrich-like just to bury our head in the sand and say that everything is hanky-dory right now. What we're actually experiencing now is the calm before the storm. And if you're not ready with our umbrellas and our raincoats, the storm will hit and we'll be totally flat out. And this storm is not like the first or the second. I'm sorry to sound a bit pessimistic, but it is the reality, and we need to prepare for it. Ghana is not exempt, and we saw it in our first wave and our second wave, and the third wave has the potential to come, or shall I say, put it more bluntly, is coming, and we just need to be ready for it. If we're ready, we'll be just fine. If we're not, we'll be caught totally flat out. And you know what is most concerning is the fact that the major solution to this is the vaccination. And I know you've already discussed this earlier in the day, but the vaccination situation is very tricky and is almost out of the control of us as a country. It's a general global issue. So I wouldn't necessarily say we're not trying our best in that front. It's just that the results we're getting just won't help us. The solution is really to vaccinate as quickly as you can. I don't even want to think about the challenges with the vaccine, even if it was available, given all the issues now with the different kinds of vaccines and the supposed risk involved and the acceptability of the vaccine and so on. We don't even have it, let alone talk about accepting it or not. And it looks like we're not going to be having the quantity that we need, which would offer us the protection at the population level anytime soon. We may be getting some in, but not as quickly as we need it. Which means that this soul-saving grace, which has been shown to be highly effective, we've seen how the UK is now, skipping all over the place, very happy, while the rest of Europe is going on lockdown because they pursue this aggressive vaccination program. In Israel now, we see the results. It's clear. It's not rocket science. It works. We don't have this. So the only thing that we need to do is really to tighten our borders and also reduce the holes in our sieve, which is by trying to pick out as much as possible. This is why I said this information on us detecting 75 is a good sign. It's a sign that we have the capacity to detect, and we're detecting. But also, like Dr. Kando said, it always raises that question that, okay, so how many slip through? Because it's a sieve. There will always be something slipping through. And the argument would be that the more you are detecting, assuming that your detection process has not changed, it obviously means that the more the likelihood of something slipping through. Now, when that happens, then you have this risk of not just people slipping through like there was in March and like there was in November, December, but they're slipping through with added baggage, which is this variant, right? And so you have the problem of the parachuted variants, and then the problem of we're not yet vaccinated, there's some transmission going on, and so the risk of de novo emergence of variants within the country. So, this lethal cocktail of locally generated, resistant strains or variants with the parachuted variants could be disastrous. And it's clear that these variants are more transmissible and more virulent. So it would call for some really quick thinking sooner than later. It may be a bit painful. If it turns out that no variants are coming in, fine. But if we don't take the painful decisions now, which will include considering mandatory quarantines, if not for every traveler, if not, and that's a heavy decision, that's what I'm saying, if not, at least for people who have traveled from high-burden countries, at least mandatory quarantine. Certainly ramp up the quality, if you can, of the testing in the airports. You may want to start subjecting a certain percentage of those who are tested by the antigen also to PCR. And then you want to take even a step further and look at even, making sure that the isolation of those who are positive is under very strict surveillance. And ultimately continue our push to get as many vaccines in as possible, any way, anyhow, somehow. I'm not involved in the vaccine procurement system, so I can't speak too much to it. But there's really nothing that is going to take this away as quickly as we wanted to, aside vaccination, and we really need to push in that direction. Otherwise, we aim for the long haul.
I'll play a clip shortly from the director of the Ghana Health Service, Dr. Kuma Boaje, indicating what the Ghana Health Service intends to do about this information, this crucial information. But let me bring Dr. Youngson first. Doc, yes, we are not seeing this in our hospitals, and we're told by the Ghana Health Service they're putting measures in place. I mean, good news, our cases are declining, but is it just a matter of when to be able to see, to begin to see some of these cases in our hospitals?
Okay, so Aisha, you see, like I said earlier, and then Dr. Amoisi also said, there's always the bit where if you don't take time, you're going to be deceived, i.e., you think that the cases are down, you play ostrich, by the time you realize it's up. I think what is happening now, I would describe this as a very good red flag that has come up now. This has set the ball rolling. We are beginning to think through and do things right. We shouldn't be so upset with the relatively low numbers in our communities now, because the more you focus on that, you begin to lose the important bit, i.e., the potential sources of importation. For example, this red flag is coming from the Kotoka International Airport. On paper, it is supposed to be the only port of entry that, in quote, officially is open to human traffic. But we all know that our borders are so porous that people still enter the country via different unapproved routes on a daily basis. And once that is happening, what it means is that we are going to have a situation where if we don't police the other borders well, or the unapproved routes well, people will come in with these highly virulent variants that we are all trying to avoid. It shouldn't be a question of just focusing on the airport and
Okay, so we're losing Dr. Yankson there. Let's listen to Dr. Kuma Boaje. He's Director General of the Ghana Health Service. He's been speaking about this important red flag from the Frontiers Group, and he says the Ghana Health Service is working at it. Listen.
Well, in the first place, the measure is to reduce importation. That's why the first time the airport and all the borders were closed, reduce importation. Open to set up systems like negative PCR before you're in plane, and then a test on arrival. And so with that, what it means is that we're able to significantly reduce the importation of the virus. So what it also means is that in the last 3 years, on Wednesday, we had about, last week Wednesday, about 45 cases. We dropped to a few, 15 or so cases. And then we jumped to the 75 cases. Yesterday was 3. All these people are currently being detained, and that policy has been in place for almost the past 2-3 months.
Right.
Where all those who are positive on that before, where you are asked to self-isolate, you are detained until you are negative. We have introduced what we call the panel bias to check the authenticity of the lab reports you bring, especially the negative PCR, to ensure they're coming from a recognized lab and it's not a fake one. So all these measures are already in place to reduce the number. And of course, this system was set up to respond to surges. And when you had in January, February, when you had the surges in Europe and others, the numbers went as far as 130 in January alone.
In a day?
No. Total for the month.
Oh, right. Okay.
Okay. So it depends on where the planes are coming from, and on a particular day, you could have more. Like yesterday, we had 1,200 or plus passengers coming to the airport, but we only had 3 positives.
Right.
So it depends. The dynamics are not just that one dump and then you skip to your conclusions. But of course, the number we have recorded so far exceed what we had the whole of March. But that is in response to the fact that there's outbreaks in India and other parts of the world, also in Ghana. And that is why the system was set in place. Right. So all those people have been taken out. They have not been able to enter. The next measure we are doing now, which we decided a few weeks or so ago, is that for those who are coming, we ask them, of course, that one already, we ask them to self-isolate. But now we are going to follow them up to do some tests to see a few days after whether they are still negative because of where they are coming from. And those are the kind of measures we are taking to it. We're charging them, those who are sick are put in hospital, those who are not sick are put in some of our isolation centers. And they are helped to oversee them until they are negative and then they are allowed to go home. So those measures already exist to reduce importation.
Okay, so you're saying that for some people, there will be another test 3 days after they arrive, even if they are negative at the airport?
Yes.
Okay.
For example,
which countries would that apply to?
Well, I don't think that one is for radio. You communicate with them and we'll follow them up.
Oh.
You and have.
Okay.
Those, if somebody is positive by your side, you identify somebody who sat next to you and tests positive. You may be negative, but we need to follow you up.
Right.
Okay? You have people who have come from certain periods who their risks are high because the incubation period is 214 days. We have decided that for those who follow up, the Greater Accra used to follow them and call them routinely to see how they are. But now we are adding a test to see whether they are still okay or not, just to ensure that those who will turn out later positive are identified quickly. And like I said, all measures in all countries in COVID is not risk elimination, but risk reduction. The PCR test before and planning and the test at the airport significantly reduces importation.
Kuma Boaje is Director General of the Ghana Health Service. I was speaking with my colleague Kojo Yanks, and when I return from this break, I'll be finding out what the fate of Ghana will be if things continue the way it is at the airport. Again, I'll be finding out. We're told the president is personally using diplomatic means to secure vaccines for the country. What difference will that make in the event we import a new variant into the country? All of that after this break. Welcome back to PM Express. We're talking about the warning from the Frontiers Group from airports saying that we're having rising COVID-19 cases. And of course, we've been hearing from the experts as to why we need to tackle this immediately. Let me come to you. I'll come to you, Mr. Akando, shortly. But first, let me gauge the mood of Michael Owusu on this. You've indicated that we need to put in measures to actually deal with this. And as you rightly put it, we may not be able to deal with a third wave. We will really struggle. What do you want to see? What specific measures do you want to see in the next few days? Dr. Michael Owusu.
Yes, Aisha. Yeah, I think I mentioned this earlier. If you listen to what the Director General mentioned or said, I mean, for the short interview that you played, we have some measures already in place, but it looks like most of this is targeted towards those who test positive. And I mean, these people are isolated and then they are managed. But the bigger question is whether for the larger number of people who test negative through the airports, what happens to them? And assuming that these people are from high-risk countries, and then they slip through this test that we are giving out. And the test we say is about 99% sensitive. What it means is that for every 100 people who pass through and who are positive, one of them, some way, somehow, may be missed. So it's good for us to quickly, as much as we can, screen these negative people, possibly monitor them for about 5 to 10 days, where there's some appreciable incubation period for these targeted people, and then see, maybe before we finally release them to the country, we have to do a double test, maybe with a PCR, to ensure that they are really free of the virus before we allow them in. I think that some of these measures will help us a lot in reducing possible introduction of these viruses into the system. I think we have some upper hand as we are speaking now, because the numbers are high, but not that out of control, not too much. If we are able to do something now, additional measures to what we are doing, I'm sure we'll be able to manage this. So I think that enhancing the measures currently in place by quarantining these negative people from high-risk countries is one of the things that government should look at quickly.
And travel restrictions?
Well, I think travel restrictions is something that has to be discussed at high level. For some of these discussions, a lot comes in terms of economic, how countries deal with other countries. trade agreements and many things that you have to look at it. India is a big country, 1.4 billion people. We have quite a number of these Indians in Ghana, and I believe that we have some form of relationship with them. So I don't know how government will want to target this, but if government has to ban flies, then a lot of discussion has to go with it. I'm not able to tell how this has to be, but for me, I think that the low-hanging fruits, like quarantine those that will be negative, is something that we can easily do whilst we think about the high-level decisions and how this will impact on the country. So the simple things, I think we have to do as much as possible, whilst perhaps we leave government and other agencies to discuss the high-level weighty.
Mr. Akando, what do you want to see in the next few days? Just briefly, we're running out of time.
Yeah, I think that we will have to, as matter of urgency, talk to the countries with a very high risk, positive cases, so that if there's a need for us to institute some kind of restrictions, we'll go ahead to do those things. We shouldn't wait till we are overwhelmed before we start putting in place some knee-jerk reactions. And so for me, it's important we look at the countries with a very high, risk COVID-19 positive cases.
I'm grateful for your time. Mr. Mintah Akando is spokesperson for the Minority on Health. Dr. Justice Yankton is General Secretary of the Ghana Medical Association. Dr. Michael Owusu is virologist at the KCCR and lecturer at the Department of Medical Diagnostics at the KNUST. And Dr. John Amoisi is a public health expert and also a lecturer at the Public Health Department of the KNUST. I'm grateful all of you for joining us on PM Express. My name is Aisha Ibrahim. Enjoy the rest of our programs.